Welcome to this short video on peripheral neurological examinations of the upper limbs for revision. The objective of this video is for you to competently be able to perform a neurological examination of the upper limb, to be able to communicate clearly with the patient what it is you would like them to do, to gain understanding in how to elicit neurological signs, and to gain fluency in the examination skill. It's also important to understand why students might fail this sedation. Some of the more common reasons are that the student lacks fluency, that they have a poor technique, especially when it comes to reflexes, that they fail to elicit signs from the patient, they give poor or bizarre differentials, or they run out of time during the OSCE station. The examination sequence starts with inspection, both general and specific, moves on to tone, test power, reflexes, coordination and sensation, including light touch, superficial pain, vibration and proprioception. Start by introducing yourself to your patient with your full name and title. Confirm that you've got the correct patient by checking their name and date of birth and how they'd like to be addressed. Explain that you'd like to do an examination of their upper limbs and what that will involve, and then gain their consent. The patient should be adequately exposed from the waist upwards, and make sure you wash your hands prior to starting the examination. As with any examination, begin with general inspection. Look around the bed area for walking aids. Are there any abnormal movements from your patient? What's the balance like while they're sitting? You could also shake hands with the patient. Is there any obvious weakness when you do that?
Just looking for any fasciculations or any muscle wasting in the back of the hands.
Look for deformities, muscle wasting, hypertrophy, fasciculation, myoclonic jerks, tremor and asymmetry.
That looks great. Okay, so the next thing I'm going to do is to check the tone of your arms.
Tone is the resistance felt by the examiner when moving the joint passively through its range of movement. Before assessing tone, make sure the patient doesn't have any pain in their limbs. Ask them to relax and go floppy.
Grand, if you relax that one down, just going to do the same on the other side. No pain at all anywhere. Grand. Relax that down for me as well. Next thing we're going to do is check the power. So if you could
test the patient's limb power and note the results using the Medical Research Council scale for muscle power. Remember that strength varies with age, occupation and exercise.
Pull your arm away. Excellent. Don't let me pull your arm away. And now push my hand away. Excellent. And the same again there. This time, if you can put your arms out, and if you cock your wrist up, excellent. And cock your wrist up there. If you push your hand down onto mine, excellent, and same again. Great. This time, could you spread your fingers? Don't let me push your fingers together. If you make a ring with your middle finger and thumb, don't let me break that. Great. The next thing we're going to move on to is to check your reflexes. So if you just
to test the reflexes, make sure the patient is as relaxed as possible. Flex your wrist and use the weight of the hammer to determine the strength of the blow. Make sure you strike the tendon, not the muscle. Compare one side to the other. If the reflex appears absent, then try to reinforce the reflex by asking the patient to grit their teeth immediately before you strike the tendon.
So relax, put all your weight onto my hand.
Record the reflexes as increased or hyperactive, normal, diminished, absent, or only with reinforcement present.
This time, if you could put both hands out in front of you, if you could close your eyes for me. Great, you can open your eyes and put your hands back for me. The next thing we're going to check is your coordination. So I'd like you to take index finger of your right hand, and I'm going to ask you to place it on your nose, and then if you could place it on my finger, and then back to your nose, and do that as quick.
The finger-nose test may reveal a tendency to fall short or overshoot the examiner's finger. If the patient performs well in the finger-nose test, make the test more sensitive by changing position of your target finger.
So index finger of your left onto your nose, onto my finger, and back, and I'm going to move it again, okay. Excellent, you can relax there. So after that, the next thing I'd like you to do is just to copy what I do. So if you take your left hand like this, Place your right hand on top of it.
Demonstrate the act of repeatedly patting the palm of one hand with the palm and back of the opposite hand as quickly and as regularly as possible, and ask the patient to copy your actions. Impairment of rapid alternative movements is typical of cerebellar disorders.
The next thing we're going to check is the sensation. Have you got any abnormal sensation, numbness or tingling in your arms? No. So firstly, we're going to check it with some cotton wool. So, can you feel that then? Does it feel
Begin by testing the dermatomes for light touch. Explain to the patient that you're going to touch their legs with a piece of cotton wool and you want them to respond with a yes to each touch. Ask the patient to close their eyes and then dab rather than stroke the cotton wool in a dermatomal pattern. If the patient does not respond to a touch, then map out the area to find whether it's a peripheral neuropathy, usually impaired sensation in the glove shape, or a dermatomal sensory loss.
Now we're going to do it with this pin here. I'm just going to show you what it feels like on your chest here.
Next, check for a loss of sensation to superficial pain. Explain to the patient that you are now going to repeat the process with a sharp object, then ask them to close their eyes before testing the dermatomes again. Ask the patient to respond with a blunt or a sharp depending on what sensation they feel. As before, map out any area of sensory loss. Remember, a neurotip is sharp and should be disposed of accordingly.
Next, we're just going to check the vibration sense in your finger. So if I could take your middle finger.
Begin by vibrating 128 Hz tuning fork on the patient's chest and ask them to tell you what it feels like. You want to do this so that you don't confuse the sensation of coldness or touch on their chest. Next, ask the patient to close their eyes, place the vibrating fork on the distal phalangeal joint. Ask the patient whether they still feel it. Assuming they reply positively, ask them to tell you when it stops, and then pinch the tuning fork to stop it vibrating.
Great. Next thing I'm going to do is to check the proprioception in your finger. So I'm going to take your middle finger of your right hand again.
With the patient's eyes open, demonstrate this procedure.
Or up. Okay? So if you close your eyes for me, tell me if this is moving down or up.
It's important when doing this procedure that you hold the finger at the side rather than on the nail so the patient doesn't sense the pressure
Do the
of
same
movement.
with the left. So take the index finger again, and it's either going to move down or up.
The examination is now over, so thank the patient and invite them to dress. Turn to the examiner and present your findings. Explain that you'd also take a full history and examine the lower limb. Other tests may vary depending on the findings, but may include the list you see below. Always avoid listing every test and examination known to medicine, and think clearly and carefully what your likely differentials are and how to test for them. Thank you for listening, and we hope you found this video useful.